The ultimate goal of nasal polyps is to make the patient feel better, and the second goal is to remove the polyps in a way that you can follow and make sure they don't recur. Nasal polyps are treated by allergy origin with antihistamines. When I talk about steroid treatment for nasal polyps, there are three components. There's topical steroids by spray. Some of these are by prescription, some are over the counter. The spray in the nose daily, and that will reduce the nasal polyps. There's oral steroids, which reduce the inflammatory reaction systemically, and that will also reduce the nasal polyps. And the third component can be to put various types of steroid into nasal irrigation, so it washes the lining of the nose and washes the lining of the sinuses if they've been opened by surgery to reduce the polyps from reforming. The problem with long-term steroids is that they have other side effects, which the patients have to be aware of, so you don't want to keep people on long-term steroids. The side effects can include gastritis or stomach irritation. Surgery is for the patient where basic care does not work, or if it's involving multiple sinuses in both sides of the nose. The surgeon has the ability to look in the sinuses for a period of time and actually see sometimes if there's a distant polyp in one of the posterior ethmoids, and sometimes give small amounts of medicines to remove it. If you think they're related to chronic sinusitis, you'll be giving them a variety of antibiotics. You can give decongestants to dry the nose, and you can give mucolytics to thin the mucus in the nose. There are now these new biologic agents. They do have side effects, and they're very expensive. But for patients who aren't treated by regular therapy or regular surgery, or can't take the regular medications, or have recurrent polyps and have had multiple surgeries, there is this new group called the biologics, which are driven for the worst patients who also traditionally have asthma and allergies. Most of the patients say the quality of life is reduced if they can't breathe through their nose. That's where the quality of life actually is improved. And patients, when you make them breathe, make it so the nose isn't running, make it so they're not coughing, make it so they can actually smell the coffee in the morning and taste what they've cooked, feel much better, and their quality of life is dramatically improved.